Hello, my name is Erin Adams. I am a social work student. I'm a grad student. I'm very excited about getting my master's degree and being able to work with children after I graduate. And I'm 25, so that makes my surgery story a little bit more exciting because I'm so young. In middle school, I was having some pain, and we determined that I had spondylolisthesis, and the solution to that was a spinal fusion. And so we chose an institution that we trusted, and so I had a great surgery, I had great results for the next 11 years, and then sort of hurt myself just in everyday life. I was in pain pretty much all day, every day. Not a great deal of pain, but I was very stiff in the mornings, which was normal for me prior, but that wouldn't really go away. The pain wouldn't really go away no matter what I did, and that wasn't normal. And so after about 6 months of not really feeling like myself, I determined that something was probably wrong. So I went to see a spine doctor at the end of January, and I went to get a CT scan and some x-rays, and we found out that my initial spinal fusion had not taken. I was not fused, and as a result, my hardware was dangerously close to my skin, coming through my skin, and so the answer was to have another spinal fusion and take that hardware out, replace it with new hardware in the hopes that I would fuse and the hardware would not come through my skin in the future. It was very important to me at 25, having my second surgery, that this would be my last surgery and that I had a surgery with a board-certified surgeon who could take care of me and knew what needed to be done to make sure I could leave his office and essentially not come back. And so that's the reason that we picked the hospital in the first place when I was 13, or my mother picked it because she trusted what they stood for and that they were only going to hire board-certified surgeons to take care of her baby, at that time 13, and that's why I felt comfortable going back to them. And then they would have, again, board-certified surgeons who would be even more knowledgeable, even more credible at this point, 12 years later, to take care of me and make sure that I could have the surgery I needed and then, in essence, wave goodbye and hopefully not come back again. If a friend came to me asking about surgery and how they should proceed, I would tell them to find a board-certified orthopedic surgeon to perform their surgery because they would be knowledgeable about their body and what's happening in the field and what needs to be done for them. That's what made me trust this process, trust my surgeon. It happened so quickly, and I was able to be relaxed about it because I had a medical professional that I trusted as a result of his board certification. I knew that he was knowledgeable about the field. I knew he was knowledgeable about my body and what needed to happen, and so that's what I would recommend to them, is finding a board-certified surgeon.